TMJ is something that all of us have. That's an acronym for temporomandibular joint, and I think we all have a pair of them right in front of our ears. TMD is an acronym for temporomandibular disorder. Now, temporomandibular disorders are very common in females between the ages of 20 and 44 during periods where estrogen is produced in high amounts. Males, on the other hand, have a much lower incidence of temporomandibular joint disorder. There are four cardinal signs of temporomandibular joint disorder: the inability to open vertically about 3 fingers width, the inability to move the jaw right and left about 10 to 12 millimeters, abnormal joint vibrations when you open and close, clicking, popping, grating sounds that sound like rustling dry leaves or rubbing hairs together, and any lateral deviation upon opening, where the jaw opens and swings to the left or opens and swings to the right. TMJ can cause headaches, can cause pain and discomfort in the jaw joints, can cause discomfort in the facial musculature, can cause stuffiness and hearing losses, ringing in the ears, a number of visual and auditory disturbances. The primary problems, though, tend to be right in the temporal areas. We can help many patients that have temporomandibular joint disorders by eliminating the cause, which in many instances is bad bites, malocclusions, or the poor fit of teeth. We begin with good diagnosis, and we begin with a first phase of occlusal splint therapy, which is not intended to be corrective, except in rare instances, but simply to help us find that jaw position of comfort. Once we find the trajectory of jaw closure and that position of jaw comfort, then we can adjust the teeth to support the jaw in that comfortable position.